We at Dorina Solutions are very excited to share with you our new solution, MeldRx, which helps EHR vendors meet the fast approaching deadlines of the 21st Century Cures Act. The 21st Century Cures Act was signed into law in 2016. The core idea behind the act was to accelerate advancements and innovation in healthcare by incorporating a patient's perspective into their own care process. Here are some of the components of the act. The biggest impact on EHRs and where we will focus today is Section 4006, which aims to empower patients and improve their ability to access their personal health information. The specifications for this act are spread over hundreds of pages, but what it really comes down to is this. Healthcare providers and insurance payers have to start providing patients access to their personal healthcare data. It's the law. When we say providers, we're referring to those providers that currently use EHRs. However, it is important to note that the Act also requires non-EHR providers to start sharing data with their patients. In future videos, we will discuss the impact on payers and non-EHR providers. But for today, we will only focus on how these rules apply to EHRs and providers. Let's take a look at how this healthcare data sharing is supposed to happen. There is a data standard called HL7 FHIR, which defines how healthcare data should be exchanged. This data exchange is secured with an open authorization standard called Smart on FHIR, which is based on the popular Common OAuth framework. You can expect this topic to be covered in greater detail in a future video. Unlike traditional patient portals provided by EHRs in the past, data is now made available through apps chosen by a patient from an app store. This is a huge change from what most patients are used to, as they are now empowered to choose from hundreds of applications built by developers to view and manage their healthcare data. Let's take a deeper look at how all of this works. First, an EHR makes data available through a FHIR API. The patient can then use an app of their choice to access the data made available by the EHRs. Interestingly, it is not only patients that can access healthcare data using these apps. This new regulation also enables flexibility for healthcare providers to access data through standalone apps or through apps embedded in their EHR platform. This new era of access to healthcare data is the key to driving innovation and is the intent of the 21st Century Cures Act. We mentioned deadlines earlier. In March 2020, the U.S. Department of Health and Human Services finalized deadlines that require EHR vendors to implement the provisions of the Cures Act. Let's take a closer look. This timeline shows each of the major certification milestones required for EHR vendors to stay in compliance. The most important certification criteria related to FHIR APIs is called G10. EHR vendors must certify and provide this G10 functionality to their providers by December 31st, 2022. There are two other deadlines that are worth mentioning. By December 31st of 2023, EHR vendors must support the bulk export of what is now known as EHI data. More importantly, by October 6th of 2022, EHRs must support the export of EHI as a part of the information blocking requirements. Let's look at what EHI means. As outlined in this infographic by ONC, EHI includes everything in the PHI category with a few specific exclusions. It includes information that goes beyond what is typically included in CCDA, which is the most common way of sharing data by EHRs today. This additional data needs to be included and made available as a part of the data sharing requirements. Many EHR vendors are evaluating separate methodologies to support these EHI requirements instead of focusing on the G10 requirements. This is a huge mistake. All EHI requirements can easily be accomplished as a part of the G10 certification through a special FHIR resource known as a document reference. This can also meet the upcoming B10 requirements for next year. In addition to G10 and B10, there are also a number of recurring deadlines that EHR vendors must comply with each and every year going forward. Back in 2020, Just months after the final specification for G10 was approved, Dorina Solutions Blue Button Pro became the first solution in the country to be certified for all of these criteria. Our solution is also B10 certified. By integrating with Blue Button Pro, EHR vendors can meet all the requirements for not just G10, but also B10 and upcoming information blocking requirements for EHI. Over the last 2 years, we've had the opportunity to work with several EHR partners to help them get ready for the Cures Act. If you've been following our blogs, you know our goal is not only to check the boxes. We checked those boxes 2 years ago. Our goal is to go beyond meeting these requirements and to accelerate healthcare innovation, which again is the true intent of the Cures Act. We realize that in order to meet this goal, we will need to think about 2 key areas that are not directly addressed in the Cures Act. The Cures Act focuses on giving access to the patient. That said, there are no guidelines for data aggregation or how to enable a patient to share their aggregated data in a secure way. This is where MeldRx comes in. The MeldRx ecosystem is designed to meet the goals of the Cures Act. It includes everything that is a part of Blue Button Pro, along with several additional components that go beyond it. As we mentioned earlier, patients will have access to their data from providers, as well as the private and commercial payers. However, the true power of this access will only be unlocked once patients can start aggregating or melding that data together. FHIR is a great start, but there's a large part of the data that still resides in other formats. How do you leverage FHIR while making sure you can support data in all formats? This is where we came up with the concept of MeldRx Data Vault. MeldRx Data Vault allows patients to aggregate their data from various FHIR sources into a single personal FHIR repository. It's worth noting, we are not using a proprietary format to aggregate the data. All data is made available to applications in a FHIR format. All of the innovation that is happening in the HL7 FHIR world can now be leveraged by an individual on their aggregated data. While the vault is FHIR ready, it also supports storage of non-structured formats such as PDF or JPEG, leveraging the same document reference that we mentioned previously. It doesn't stop here. We have designed 2 simple ways for a patient to share this data. The first is real-time access, which allows a person to provide their data to a provider or a researcher for a limited or specific amount of time. The second, called Synapse, allows a person to share their data as a package. This sharing leverages a concept in the FHIR world known as a FHIR bundle, which enables any FHIR-ready solution to receive that data in its system. Let's take a look at how this works. We started with a single link, a provider sharing data with the patient. We now give the patient a MeldRx personal data vault and allow them to import their data. Now that they've got a MeldRx data vault, the patient can also pull data from other providers and payers into that same vault, all collected in a FHIR format. Now comes the best part. The patient can share this newly imported data back with the original provider. This change from a one-way to a bidirectional secure communication opens several opportunities to improve patient care. Imagine a patient walking into a clinic for the first time, and with a simple scan of a QR code, they can begin to share their data with that clinic. This is the power of MeldRx. In our upcoming sessions, we will showcase how this can help manage tasks specifically around care management for multiple chronic conditions. This data sharing is not restricted to providers. The individual can share data with registries, research, or back to payers for some specific use cases. A key concept in MeldRx is a data custodian. In this case, an individual can manage her account, but she could also act as the custodian for other people, such as her son, her spouse, or her mother. Each of these individuals has their own dedicated personal data vault. Let's discuss how a provider gets data from a patient. The 2 APIs, real-time access and Synapse, can be directly integrated into an EHR for access to the data. Alternatively, the provider can leverage the MeldRx portal to view the same shared data. That said, the integration with an EHR is not limited to the real-time access and Synapse connectors. We have built a comprehensive set of APIs to seamlessly meet Cures Act compliance and more. Introducing the MeldRx ecosystem. As you can see, this goes well beyond meeting the bare minimum requirements. Over the next few weeks, we will be exploring each of these components with live demos, pilot clients, and hands-on workshops. If you are an EHR vendor, join us for one of our upcoming deep dives where we will take you through the whole process of meeting Cures Act requirements and beyond using MeldRx. During the session, we will show you how to set up a FHIR API, upload data, manage patient invites, enable developers to connect to data, export FHIR data in bulk, and test FHIR APIs against the Inferno tool. Go beyond meeting the Cures Act requirements and truly embrace healthcare interoperability with MeldRx.